Efficiency. We want it in every service available to us, and healthcare is no different. Recently, Wellmont Health System adopted a new electronic health record that will help provide a more efficient experience to patients when seeking medical care. This new electronic health record is the aptly titled Epic system.
Epic is the company that makes our new electronic health system for Wellmont Health System. About 18 months ago, Wellmont Health System was on an electronic health record system from another vendor. And in fact, we had multiple vendors providing our electronic health systems across the system. So our hospitals were on one electronic health record, our physician offices were on a different electronic health record, etc. So we had multiple systems, which really led to a lack of integrated information for our practitioners and our hospitals. Our current vendor at that time decided to change platforms, and so we were presented with an option of either going with the current vendor's new platform or moving to Epic as a provider for our electronic health record. Because many people on our senior leadership team had worked with Epic, and it's one of the most widely deployed and popular electronic health systems in the country, we began to have some dialogue with the folks at Epic and landed on Epic as our vendor of choice for the entire health system. That decision really allowed us to begin to think about the integration of an electronic health record and allowed us to consider our future with our physician practitioners, our urgent care centers, our hospitals, all of our ambulatory locations being able to be on one single electronic health record.
At first glance, it might not seem like such a big deal, but the benefits to both the patient and the physicians are numerous.
The benefit for patients is really far-reaching. First of all, being on one single platform as opposed to multiple platforms for an electronic health record means that every care provider in every venue of Wellmont can see the same thing, can see historical information about a patient, can see concurrent information about a patient. And so as you think about a patient walking through the health system, they may see their primary care physician today. They may have to have a minor surgical procedure in a month. They may in 2 years have to be in the hospital for serious illness. And every practitioner at every one of those locations can see everything that has happened to that patient since we've been on Epic. So the information translates across settings in a way that is very useful to the clinical providers and results in a higher degree of safety for patients. It also means less redundancy. So certainly you all have heard with Obamacare recently that one of the issues is that healthcare is duplicated when you go from practitioner to practitioner. Because the health systems and records are not well connected, when you see one specialist for one thing, he might order a test for something, and when you see another practitioner 2 months later, she might order the same test for a different reason. And so one of the advantages of Epic is that we wring out the duplication in the health system, resulting in lower cost, less frustration, less confusion for our consumers.
So one of the major advantages of Epic is if we have folks who are visiting from out of town, say, of course we have the 2 big race weekends, we have people visiting, if they have been on an Epic system somewhere else, if they have been treated in a healthcare system that uses Epic, those records are available to us through the product. Once again, we click on a link and those records come directly to us so we can see them. So the advantage there is if they are being treated within an Epic system anywhere in the world, not just the United States, those records are available to us real time, and that's a big advantage of Epic. Epic also touches better than 50% of the patients in the United States right now. The medical records are impacted by Epic in one form or another, and better than 50% of the patients in the United States currently.
With all of these benefits that the Epic system provides, patients are going to see even more long-term benefits as time goes on.
I think ultimately our patients will benefit from having all of their practitioners across Wellmont and in the region have access to their electronic health records. They'll be able to see the history of their care, plan for future care, make sure that we wring out duplication in that care, and then ultimately our patients will have access to something called My Wellmont. And My Wellmont is the patient portal that allows patients from their home or their phone ultimately to access their own secure, protected health information. So they can look in My Wellmont, their portal, they can see when their children's immunizations are due, they can see when their mammogram is scheduled, they can see what their lab results were that have been released by their physician. And again, this allows them to really be in touch with their own health care, to be more in control of their own health care, and to really be a partner with their practitioners in their health care.